Thanks for joining us for ABC4 News at 4. I'm Emily Clark.
And I'm Rick Aaron. We begin this afternoon with a growing crisis inside Utah hospitals where doctors, nurses, and administrators are struggling to find beds to care for patients amid the latest surge of COVID-19 cases. Today, a physician from Intermountain Healthcare said their intensive care units are over capacity.
We're in a pretty dire strait right now.
That's how Intermountain Healthcare infectious disease physician Dr. Eddie Stenium describes the situation in intensive care units.
As of yesterday, our trauma COVID hospitals were at 102% capacity in ICU. And so that's staffed beds. So those are available beds that are staffed by clinicians, nurses, physicians, advanced practice practitioners, et cetera. And then we're at 102% capacity. Our floors, or acute medical surgical floors, are not far behind at about 98% capacity. So we're full, completely full. So when you get a trauma patient, when you get a MI patient, a heart attack patient, a stroke patient that needs an ICU bed, you got to figure something out.
Dr. Stenium says caregivers are working extra hours and extra days to take care of the constantly arriving COVID-19 patients, 90% of whom he says are unvaccinated.
Now seeing patients come in the hospital and that are suffering where they didn't need to be. You know, the majority of patients that are coming into the hospital with active COVID-19 are not vaccinated, and they could have been vaccinated. And if they were vaccinated, the vast majority of these hospitalizations would have been avoided. And so seeing that so acutely of a preventable episode of suffering is just so wearing on our caregivers.
Now administrators have to make difficult choices about the level of care some patients receive and possibly delaying elective surgeries. Dr. Stenium says he and his medical colleagues are exhausted physically and mentally.
I haven't seen morale this low in a hospital I don't think I've ever seen it this low, period. Our caregivers are really strained. We're kind of staring down the barrel of a potentially really bad fall and winter without a whole lot of relief unless something changes.
This afternoon, a spokesperson from University of Utah Hospital confirmed to ABC4 News that their intensive care unit is also at 100% capacity. According to the Utah Department of Health, 85.5% of all ICU beds in the state, 344 of our 422 are currently occupied.